Hello, everyone. Welcome to today's webinar, Changing the Discourse About Community Violence. To prevent it, we have to talk about it. My name is Heather Gellert. I am the Senior Manager of Communication and Digital Strategy with the Berkeley Media Studies Group, and I'm very happy to be your webinar host today. Before we get started, I'd like to just quickly review a few housekeeping notes with you. First is, if you experience any technical problems at all throughout today's webinar, please contact the number on your screen. It's 1-866-229-3239, and I will also send that number out through the chat box in a few moments so that everybody has that handy. Speaking of the chat box, we encourage everyone to submit questions throughout today's webinar. You can do so by using the box that will appear in the lower right-hand portion of your screen. Please just make sure to select all participants from your drop-down menu when you submit your questions, and that will guarantee that our presenters see the questions. If you choose all attendees, our presenters would not see that. So again, please choose all participants and you submit your questions through the chat box. And finally, we encourage everyone to join the conversation on Twitter. If you plan to do any tweeting during today's webinar, you can do so using #SafeCommunities. It's now my pleasure to introduce you to our moderator, Mego Lien. Mego is an Associate Program Manager with the Prevention Institute based in Oakland. She joined CI's Injury and Trauma Prevention team in February of this year, and she supports programmatic, policy, and communications work that advances a public health approach to violence and injury prevention. Thanks so much for joining us, Mego.
Thanks, Heather. And hi, everyone. It's great to be here today. I'll start off by presenting to you, introducing our presenters today for this webinar. We have two presenters, Pamela Mejia with Berkeley Media Studies Group. She's a senior media researcher, and Pam directs the research program at BMSG, and she's been working on this Changing the Discourse project from the beginning a number of years ago. Denise Alexander is our other presenter. She is the communications manager in the External and Community Affairs Department with Kaiser Permanente regional offices. And Denise has been a key partner working with both Prevention Institute and BMSG for the last couple years on this work. So those are our presenters, and a quick outline of what we're going to be covering today on this webinar. We'll do a brief introduction talking about why this project on changing the discourse on community safety and why are we undertaking this work now. And then we'll hear from Denise, Pam, and myself in that portion. And we'll do a little bit about covering an understanding of the current discourse about violence and violence prevention, particularly in the news. Then Pam will present the report that we're launching through this webinar, talking about the news about community safety and the scan that was done by BMSG, some reflections on the findings, and recommendations for next steps. And in our conclusion piece, we'll have a bit of a Q&A time to discuss with you, and we'll also share some recommendations that came out of the report for changing the discourse. Just quick acknowledgements before we get started. We'd like to thank, of course, Northern California Kaiser Permanente, the Community Benefit Department, for supporting this work. Thanks to other Prevention Institute staff, including Rachel Davis, Annie Lyles, and Lisa Parks, who gave a lot of feedback throughout the process on this project, and also all of the community leaders and prevention practitioners from around Northern California. A lot of their wisdom and experience is reflected in the work that's going to be presented today. So I'll hand it over to Denise to kick off the introductory piece and talk a little bit about why Kaiser Permanente is sponsoring this work now. Denise?
Thank you. So why Kaiser Permanente? A question we get a lot both internally and externally is, why would a healthcare organization invest in changing how people think and talk about violence. I can say that this is directly part of our community safety portfolio. It's a reflection of our commitment to prevention and total health. We really recognize that keeping people well requires more than quality health care. We are both a care provider and a health plan and helped develop the Adverse Childhood Experiences Study. Probably many of you are familiar with that study and that work. And our violence prevention portfolio, which has become our community safety investment portfolio, it's evolved over the years, for many years as we were working on healthy eating and active living, and we became more familiar with the conditions influencing community health from a healthy eating, active living perspective. So as a care provider that treats victims of community violence and a health plan that understands the full range of costs associated with that, of course, most importantly, the loss of human life and a community's ability to be vital and economically secure, we recognize that we have a unique and valuable perspective and experience to bring to the table. And that experience also gives us a credible voice to raise, and we feel a deep responsibility to do so. So that's really why we engaged in this project. Based on our communications work with our grantees and our own media relations team experience, you know, we had a baseline understanding or an intuitive feeling that the coverage about violence was episodic at best, and we wanted to learn more and have tangible data that we could point to. And that's why we've been working with the Prevention Institute and specifically for this study, the Berkeley Media Studies Group. When we were setting up our violence prevention, now community safety portfolio, we set a very specific goal to change the discourse around violence in the public so that it could focus more on solutions and hope rather than just perpetuating stereotypes and fear. So that's it in a nutshell. And we're very excited about the findings and hope you all will get excited about the opportunity to effect some change in this area.
Great, thank you, Denise. Yeah. Great, thank you. I'll move on then to, for people who don't know, a little bit of background on Prevention Institute, and then Pam will say a little bit about the MSG and their role in this project too. So Prevention Institute, we are a national public health nonprofit. We're based in Oakland, California, and we really work on bridging research and practice in public health and bringing analysis to some of the pressing public health issues that are affecting the country. And obviously, one of the big topics of concern right now is violence and violence prevention. And so why Prevention Institute is interested in this work, we know that media plays an important role in all public health efforts, and this obviously applies to violence prevention as well. We know that the news narrative has a strong influence on public opinion and also, as a result, policymakers' opinions in this country. The news narrative also is a reflection of the communities that we work with, and therefore it has an impact on the communities and on our own work to promote community safety. Unfortunately, as Denise started to allude to, we know the characteristics of the current discourse and news narrative from both our work with violence prevention practitioners on the ground and also our own, personal consumption of media. I think everybody can all picture in their minds kind of the typical sensationalist story about a crime that just occurred, and you would see that on kind of the nightly news on TV or in the newspaper. But generalizing about news on community safety and violence right now as a whole, it is, as Denise mentioned, quite episodic, where crime is sort of depicted as a series of isolated events or individual events, and there's very little talk about the broader context. We find also there's an over-coverage of crimes that are committed by people of color, and while at the same time crimes committed by white people tend to be undercovered. At the same time, youth, and especially youth of color, rarely appear in the news. And when they do, it's often connected to violence, as you see here in this example, Life in the Killing Zone, describing East Oakland. And when the news tends to cover solutions, the solutions tend to focus on criminal justice approaches, which is another problematic aspect of the current discourse. I'll just encourage you here to participate by adding into the chat box any characteristics of the current discourse that you might have observed through your work or your personal experience. We'd be happy to hear from you. The issue with the current discourse is that not only is it problematic, but then this poses a disservice to our own efforts to promote community safety. So we find that this discourse fosters fear and really serves to reinforce stereotypes, especially about men and boys of color, and to men and boys of color as they're kind of consuming this media. There's often a negative portrayal of the communities that we're working in. And in our pursuit of multi-sector solutions, the media can be a disservice because it's kind of framing violence as an individual issue without, as I mentioned, talk about the contextual factors and really ignoring the role and the responsibility of all of us and multiple sectors and systems in preventing violence. So the question really becomes, how do we move from more of the current discourse that I just described to more of something like this? This is a recent NBC Bay Area story that talked about the role of the economy in contributing to gun violence in Oakland. And this is great because we can see this shift from moving from blaming individual behavior to highlighting the role of environmental factors and the root causes in violence, where this kind of coverage doesn't stigmatize a particular person or group of people or populations, but really supports the multi-sector approach to preventing violence and the fact that everybody has a role to play in promoting community safety. So with that little intro, I'll hand it off now to Pam to talk about BMSG and segue into the study itself that was conducted. Pam, are you there?
Hello, can everyone hear me?
Yep, you're on now.
All right, fantastic. Hi, everyone. Such a pleasure to see you, even through this sort of digital online space. As was mentioned before, and thanks to Mago for the great introduction and for Denise for all her comments on the way that Kaiser is supporting and providing infrastructure for this work locally and beyond. I am the Senior Media Researcher at the Berkeley Media Studies Group. I direct the research program there, as was mentioned, and as was also mentioned, I've been with this work since it began. For those of you not familiar with Berkeley Media Studies Group, I'll just say a little bit about who we are and the way that we conceptualize news, particularly as part of this one piece, a very important piece of this broader discourse and narrative around community violence and safety that was referenced earlier. Then I'll dive into a little bit about the findings, but I'm really anxious for folks to be able to hear from people about their questions and thoughts on this work. And also, of course, I would love for people to read the memo that we're going to be linking you to at the end of this, and that we'll also be sending out PDFs to all participants. So I'll try to keep my comments fairly brief so that we can make this discussion as interactive as possible. Berkeley Media Studies Group, as you can see on your screen, is a project of the Public Health Institute, which is based in Oakland, California, but we are, as the name implies, located in Berkeley. And our task is threefold. So we research a news coverage, how the news covers or fails to cover public health and social justice issues with an eye towards identifying not only limitations but also opportunities. We provide media advocacy training and strategic consultation for community groups, researchers, advocates, leaders, anyone who is really interested in learning how to use the news more effectively to make the case for the policy changes they want to see. And finally, we provide professional education for journalists because we know that the media is a two-headed beast, shall we say, and so that for the media to tell the kinds of stories we want to see. Not only is it a matter of providing the kinds of sources and resources that journalists need, but also equipping journalists with the tools and resources and questions to ask to tell those kinds of stories. And we're often asked here at BMSG why we focus so intently on the news. And I think I'm lucky today that in the context of this conversation, we've already heard a little bit about why the news matters, but I'm just going to say a bit here about the way that we view the news as a part of that broader cultural narrative or discourse around violence. We know that the news, as it relates to any number of public health and social justice issues, it sets the agenda. It determines, or it shapes and reflects what we think about and how we think about it. And not only does it affect what we think about, but it also shapes what we're not thinking about, the solutions that we are or are not seeing as part of that conversation, the speakers that we see as having a role in the debate or as being ignored completely. And finally, the news does not just reach us, the general public, but it also, as Mego mentioned earlier, has the capacity to reach opinion leaders at every level. We know that opinion leaders and policymakers learn about issues from the news, particularly issues they may not have firsthand experience with. They view the news as a barometer of what their constituents care about, what they may be called to task or held accountable for at the next city council meeting, whatever else. So we know that the news plays an important role in shaping our cultural and our political agenda and determining who speaks and who doesn't, and that it is an important and highly credible piece of the discourse around violence and what to do about it. So with that in mind, we at BMSG a few years ago were very lucky to be able to begin this work in conjunction and partnership with Prevention Institute and also with Kaiser. And our first question, if we're kind of thinking about how we can change the news narrative, change the discourse around community violence and safety, is we need to understand what it currently is. We need to understand the strengths and the limitations of that coverage and where the opportunities are for us as advocates, as practitioners, as concerned citizens, as researchers, as whoever it is that we find ourselves in this debate. So I am, as anyone who knows me knows, I am a huge methods nerd, but we have a very short time together today, and I know that not everybody loves methods as much as I do, so I will try to keep this section pretty brief and say that we sampled violent news coverage that was published between January of 2013 and December of 2015 that appeared in top California newspapers as well as their online equivalents. And we focus specifically on Northern California because, of course, that's where many of us are working and a lot of local action is happening. So we looked at news and online news from San Francisco Chronicle, Contra Costa Times, Sacramento Bee, the San Jose Mercury News, and the Oakland Tribune. But we also explored what was happening in the Los Angeles Times to give us a sense of kind of the larger picture or patterns of news coverage in California. And the stories that we looked at all used language that evoked community safety or community violence. So violence in communities, safety of our communities, community violence, community safety, any variations thereof. And I want to just say a little bit about why we looked at the phrases community violence and community safety. That frame really came to us and was inspired in large part by some important work that Prevention Institute did, interviewing and having in-depth conversations with violence prevention practitioners and leaders around Northern California who shared that this is really a frame that they're moving towards because it's more holistic. Some quotes that we heard were things like, community violence is a better term than youth violence because of the negative associations of youth violence. We heard people say, although youth are directly impacted, meaning youth are often the direct victims of such violence, the community as a whole is also affected. So in essence, we decided to explore this community violence and safety frame because the people who are best poised to make the narrative shifts that we want to see, who are doing this work on the ground every day, they are the ones who are talking about, they are moving towards a community violence and safety frame because it moves us away from some potentially really harmful and damaging stereotypes about violence, and it's a more holistic narrative as well. The last thing I want to say about our research methods is that, as I say, we did look at newspapers and their online equivalents, and we know that increasingly the news landscape is shifting towards social media and towards digital and community-created media. But we also know that, at least for the moment, these traditional news sources are still setting the agenda for what's covered in social media. They're still shaping the debate in a way that, by and large, social media and digital sources are not quite yet. So we wanted to explore that news coverage that has the greatest potential to get to news to policymakers, and that has the greatest potential to shape the discourse as it is now. Well, I could say a lot more about our coding instrument and our qualitative methods strategy. I will say that we use scientific methods to ensure that what we're seeing is generalizable, so that what we're talking about is a small sample of the news discourse, but we can really extrapolate it to tell a much larger story about the conversation in California, and in Northern California specifically. And if folks have questions about that, I'm very, very anxious and excited, as you can probably tell from my tone of voice, to discuss that a little bit more in depth in the question and answer session, or of course to follow up with people offline as well after they've had a chance to read the memo. But for right now, what I'm going to do is move a little bit into some key findings, which again are dug into in more depth in the report. But I want to say a little bit now to seed our conversation and hopefully whet your appetites.
And Pam, can I just interject real quick?
Absolutely.
On the questions, there's already some good discussion going on in the chat box, and I just want to encourage people to, as questions come up, you don't need to save them for the end. You can type them into the chat box, and we'll kind of collate them and summarize them and address them at the end of Pam's presentation. Thanks.
Absolutely. And I'm seeing great questions, again, in the chat box around how we define violence. I'll briefly say here, just as a clarifying point, in the context of a news analysis, we're defining it the way that the way that the journalists and editors are defining it. So anything that's categorized as violence in communities is qualified as such. By and large, the violence that we saw referenced in these kinds of stories tended to be street-level violence, gun violence, things that would often be categorized as I say, street violence, gang violence, youth violence, et cetera. But the practitioners we spoke to are really urging us and doing important work to move away from that framing because of its potentially negative and limiting associations. So to just say a little bit about the coverage that we found, the first thing that I always like to start, anybody who's had the pleasure of hearing me speak about my work can tell you I like to start big and then zoom in on some of the more specific frame elements. So one of the first questions I always just want to ask is, well, how much coverage was there, right? I mean, how many stories or how many articles, how many blog posts, whatever else are we talking about? And what we found for the purposes of this analysis was that stories about individual crimes, stories about murder, for example, tend to dwarf stories that take a more holistic approach, that use this more holistic and inclusive frame of community violence or community safety. This is just one example of the kind of analysis that we did. And again, this was looking at stories that referenced murder and gun. And so these stories in the green line up on top are overwhelmingly about individual incidences. They sorry, I got distracted by the chat box for a moment there. Y'all are having such a rich conversation over to the side. Stories about these kinds of individual instances tend to dwarf the stories, again, that are more holistic, and that can have a lot of implications for the way that violence is framed. If, by and large, the stories that we're seeing are overwhelmingly about individual crimes without a lot of context, without any focus on the solutions or on the many actors with a role to play in preventing it, what does that do for our perception of violence as a preventable problem? What does that do for our perception of violence as an inevitable problem, just a series of crimes without any solutions? These are important questions that I'm really glad we're exploring together, but I think that this chart gives us some important context for understanding how this more holistic and inclusive frame is or is not appearing in our news dialogue. And I'll say here that by and large, we found that stories about, for example, murder that just talked about murder appeared in these news outlets about on an average of 21 stories per week, compared to fewer than 4 stories a week that talked about that talked about community violence, community safety, or any variants thereof. So stories about, for instance, murder are about 6 times more common. I think that maybe the takeaway from this then is to think about that as we're going ahead with thinking about the implications of this frame, that we're talking about a very small pool of stories. But as we'll see, we're talking about a pool of stories that has tremendous potential to shift the way that we talk about our communities and what's happening in them. All right, a second question that we always ask here at the MSG when we dive into any news topic is, well, why were the stories in the news, right? We know that instances of violence and indeed hopefully prevention and community building work are happening every day. So when a story achieves news prominence, what is it that makes it so prominent? What catches a journalist, a blogger, an editor's eye and makes them say, yes, that today? Well, what we found when it came to those stories on that little orange line on our previous slide about community violence, community safety, is that overwhelmingly when stories about community violence or safety in communities were in the news, it was because something had happened that we described as a milestone in a policy, in a program, or in a community initiative. So that could include the unveiling of a local website to connect neighborhood residents with one another and with their police force. It could be shedding light on the progress of a community safety partnership in an under-resourced area of Los Angeles. It could be discussing the recent passage of bail reform or another policy that would have implications for community safety on a state level. It could be a recent letter from a concerned parent organization relating to justice reform in schools. This was a big category, but it was very, very rich and nuanced in helping us think about and see the things that make community violence and also community safety newsworthy. I want to emphasize the most important thing I think for me about this slide is how rare this is, because overwhelmingly when we see stories about, for instance, individual crimes like the murder stories that were on the previous slide, they're usually in the news because of that second bullet point you see up there, the one that says milestone in a criminal case. So overwhelmingly when stories about individual crimes are in the news, which we know do tend to dominate that conversation, they're there because somebody got arrested, somebody got arraigned, somebody got hurt. Again, and the issue is moving through the criminal justice system. But that isn't the case with our stories about about community violence and community safety. In this context, stories tend to be in the news and be newsworthy because something is happening to address the problem. So again, this is a really, really interesting finding. The other thing I just want to point out here is that you'll notice that the years that we talked about, the years that we analyzed, were 2013 to 2015. So those were some years that had major events happening, that are still happening, that have national reverberations and implications around community violence and safety, riots, police killings, et cetera. And we found that as the Black Lives Matter movement gained prominence and additional instances of police violence and brutality came to the forefront, that controversy news hook that's down there at the bottom really rose significantly in 2015. And controversies also included debates about things like Prop 47 and other potentially controversial policies that were taking place and achieving prominence in California and their local ramifications in Northern California specifically. So again, some takeaways for this is that community violence and safety are notable or newsworthy because of milestones in solutions, and that is really unusual because overwhelmingly stories about individual crimes tend to be in the news because of a criminal justice event. All right, so I hinted at this when I spoke a little bit about some of the national incidences that have had ramifications across the country. in our discussions and the discourse around community violence and safety. And what we found over the course of our 3 years of study is an emerging frame that evoked racism as an issue at the heart of community violence, and that further evoked addressing racism as essential to building safe communities. As you can see at the top, articles that mentioned race or included substantive discussions of race and racism rose significantly over the 3 years of our study. We saw really important and powerful quotes and arguments from community residents, leaders, and others, as when Pastor Ben McBride in an Oakland paper said, "How do we humanize and restore the invisible humanity of young Black men? They want to be safe and live free from the scourge of violence and incarceration. We shouldn't judge them because of cultural differences, but look for opportunities to heal." Another quote from a Bay Area resident held, "There's another kind of safety, particularly if you're a person of color. People need to feel safe from racial profiling. They need to feel like their kids can walk down the streets." These kinds of nuanced conversations about racism, structural racism, and its impact on community violence were significantly more common, as I say, by 2015 in comparison to 2013. Potentially due to the, as I said, national impact of instances happening, and including riots and things like that across the country. Now, specifically, police violence was an emerging frame, and that frame held that community safety includes safety from community violence and racial profiling. So you can see that this wasn't a huge percentage of articles, but in 2013, only 1% of the stories that we found about community violence and community safety talked in any way about police violence. But by 2015, that had risen to 14% of all articles. And that included not only discussion of national instances like the riots in Baltimore and Ferguson, but also discussions of local instances of police violence and the need for police accountability and reform. So what did the news say we should do about these issues? Well, here's an interesting little point that I'll make. Having worked in this field and done qualitative research for 6 years now, and being a news consumer for many more, as all of us I'm sure here are, the news tends to overwhelmingly focus on problems, not solutions. That's particularly true in news about crime, where, as I said, stories are almost always in the news because a problem happened. And there's often in-depth discussion of all the bad things that, bad people are doing to one another. The news about community violence and safety is different because that news focuses on solutions, and it increasingly focuses on prevention. So when we did this analysis, we explored how the news characterized a range of solutions to violence. And what we found is, A, that solutions are a big part of the discourse, and B, that prevention, anything designed to keep community violence from happening before it starts, is a huge part of that discourse. And increasingly, we also found that there was that the shape and the face of what prevention of community violence could look like changed significantly over the course of the 3 years of our study. Again, as that shifting conversation about racism, about police accountability, et cetera, was happening, we saw that in 2013, when the news discourse focused on prevention, it was all about increasing policing. Right? So more cops on the streets, harsher sentences, et cetera, to keep violence from ever happening. By 2014 and by 2015, the discourse had shifted somewhat, and now community prevention programs were the main topic of conversation when prevention was in the news about community violence and safety. And so these were a whole range of community-led efforts, from Project Ceasefire and jobs training programs to school interventions to increase mindfulness and address conflict resolution. A couple of other things that we saw starting to happen in 2014 and 2015, police reform became a part of the discussion, especially in light of ongoing national and local conversations about police violence and the shootings of unarmed Black and brown men. And finally, we saw this thing that we've called for the purposes of this work, challenging stereotypes. And what that meant was in 2014 and 2015, as the conversation about community prevention increased, as discussion of increasing policing fell slightly, we also started to see this ongoing narrative about the need to, as an earlier quote said, address and embrace the humanity of young Black and brown men and women, the need to face our destructive stereotypes that we as a nation may hold about our Black and brown communities, and our need to overcome and address and really confront these really challenging and difficult conversations and racial stereotypes that are damaging and hurting our communities. And that's a really unprecedented conversation to be having in the news. Again, these aren't a whole lot of stories. Community violence, community safety, not a huge part of the news conversation yet, but when it is there, we're seeing difficult, nuanced, challenging, and ultimately, we would hope, positive conversations about what it takes to end violence and what it takes to ultimately change the way that we view one another and the way that we honor and celebrate one another. So this was an incredibly powerful finding and really something that stood out to us, that stood out to me as a person who's been in this field for some time. This is not a conversation and a narrative that we usually see, and it could represent an important place, an important transition point for all of us in this work as we think about how to shift the discourse and elevate the stories and the programs and the work that we want to see. With this increasing focus on prevention, we also saw an ongoing focus and an increasing attention to the root causes of violence and the web of issues that underlie it. And not only that, but the kind of multi-sector collaboration that's needed to address it, the sort of multi-sector work that Mago spoke about earlier. This is one of my favorite quotes from Reverend George Cummings, who said, impoverished communities don't have access to education, have limited access to jobs that pay a living wage. A web of issues creates communities that produce violence. And unless we address the root causes, we won't be able to make progress in the long term. So this is an example of the kind of emerging frame we saw and the power of it in shifting our view of who causes and what causes violence and what needs to be done about it, who is implicated in the work that we all must do to build safe communities. Well, the last data point that I want to mention, or one of the last data points I want to mention before we pivot into thinking a little bit about the implications of this work and then into the question and answer session that Mago will facilitate, is this issue that we've touched on here again and again about who has a voice in the news, who has a role to play, who gets to speak in framing what a safe community looks like or what violence prevention could look like. And what we see here on the screen and what we delve into more in the memo is that across all 3 years, by and large, perhaps not unexpectedly, criminal justice representatives and representatives of local and state government really dominated that conversation. But what we also saw was that if you look at the bars by community resident, from 2013 into 2014 and 2015, community residents became an increasingly prominent speaker and had an increasing voice in the news and public narratives around community violence and community safety. So again, this story, the story of community safety and what it means and what community violence, how it impacts us, that is still a narrative that's very much dominated by criminal justice professionals and to a certain extent government speakers, but the voice of community residents and leaders is becoming increasingly part of that discourse and narrative. And that's an important, again, in thinking about important moments for sea change and for shifting the narrative, it's really valuable for us to be thinking about, well, if this is a trend that's happening, if community residents are becoming more and more a part of the speakers with a voice and a role, then how do we leverage that shift? How do we ensure that their voices are increasingly being heard and that they're having the opportunity to say to shift the narrative towards the kinds of preventive solutions that we want to see in that public discourse? Well, the dominance of speakers from the criminal justice and government realms, I think, underscores one final point that I do want to make. which is that the news about community violence and community safety, like the news about violence, tends to obscure the larger context in which violence occurs, and the many players, the many institutions, from our schools and our hospitals to our businesses, that are a part of building a safe community and addressing and preventing community violence. We know from the powerful work of Prevention Institute and others, many of whom are on this call, that a lot of different sectors, like the business sector, the healthcare sector, the education sector, all have a role to play in preventing violence and building and maintaining safe communities. And part of changing the discourse and helping people understand community violence as preventable is really about making that context and making all those different sectors, all those actors more visible in the discourse, and in this case, the news about this issue. So with Prevention Institute, a big part of this work has been exploring what cross-sector collaboration to prevent violence could look like, and also identifying opportunities in the news about and from different sectors to connect with community safety and connect with violence prevention. What we found is that, and we, again, as I say, we delve into this in the memo. I'm really hoping that folks will read the memo and digest it and send me emails about it. I'm so anxious to hear thoughts and discuss it further. What we found is that there are a lot of opportunities to connect stories from different sectors, stories from different news sectors with community violence prevention and community safety, but a lot of those opportunities are being missed. So what are some opportunities that are appearing? Well, we found that education news, for example, include lots of stories about graduation rates and other educational benchmarks that affect individual and community outcomes in terms of safety and health. We found that healthcare stories, for instance, are focusing on healthcare costs and healthcare access, both of which we know from the research that Prevention Institute and others have done have important implications for how well people are able to access things like needed mental health care and other services that could help prevent community violence before it ever starts. So the takeaway here, and one of the key takeaways I think we found from the memo, is just the range of opportunities that exist to draw attention to cross-sector collaboration and its possibilities, and the extent to which perhaps we are missing or failing to take advantage of those opportunities. And part of the work that we're doing as a project team and hopefully in this space together is thinking about how to capitalize on and build those opportunities. So before we pivot to the questions and answer, I just want to say a little bit about what we found in terms of what we can do to shift the discourse and how we can build on these and other findings. The memo that's available on bmsg.org and that we'll be sending out afterwards, it does include a lot more context, a lot more work and thinking about this. But I do just want to summarize a couple of key points and findings that we had that I hope will seed our discussion. The first is this, when asked about violence include prevention, what we are really finding is that the community violence and the community safety frame that we're finding is such a powerful opportunity to tell nuanced stories about prevention, stories that underscore really the role of different stakeholders and sectors in building and maintaining safe communities. So it's so critical that we think about how when we're in a reactive position or when we're being asked and talked with about violence, how we can bring forward that community violence and community safety frame and also bring to light the prevention that we know is happening and needs to happen. Using opinion space, so we found so little opinion coverage. It's not something I had a chance to speak about here, but there was very, very little, and that means that there's very few opportunities that health experts and advocates, researchers, et cetera, are taking the opportunity to shape the public and policy agendas around community safety. So we're really encouraging folks to, and encouraging us all to think about how we can be proactive and reactive in submitting opinion pieces to newspapers, prominent blogs, on social media, and in other spaces. We also really encourage and like to think about how advocates and practitioners, the people doing this work every day, can monitor the news, can monitor the stories that are being told about their work and their communities, and then be ready to respond, be ready to, for instance, write in, to engage, to address incomplete or inaccurate coverage, or to compliment reporters on work done well and connect them with further resources. That's really an important way to become a valued and trusted source for reporters, and that helps expand the field of spokespeople. We know right now that criminal justice speakers are still really the dominant force, the dominant narrative, the dominant speaker in this narrative, and that they're going to, by and large, not unexpectedly, advocate for criminal justice responses. So if we want to expand the field of solutions and solutions we're talking about and stories we're telling, it's really important that the news conversation include speakers and experts from a whole breadth of sectors, not just criminal justice, but education, healthcare, business, community leadership, the faith community, et cetera. And that'll help broaden the perspectives and range of solutions that can get into the news conversation and that can become part of the dialogue and the discourse that is then seen as a viable source of information for what our communities could look like and what our public safety and policy agendas could look like. When I want to just say a little bit here about building relationships with media professionals. I know I'm going pretty quickly, but I do want to leave space for questions. We know that reporters are going to go to who they've always connected with, and so a really important piece of bringing a broader range of voices and perspectives to our conversations about community violence and safety is about developing relationships with journalists, and that includes community journalists and social media journalists and all the different people that we know are creating news narratives, and making those different perspectives and those different voices and views on community health and community safety and community violence visible. Because we know that they can only incorporate those views journalists can only incorporate those views into their work and include diverse sources if they know that those sources are out there and they know about the data, the important work that's happening, the powerful stories that go beyond one bad person doing one bad thing to a broader story and a broader narrative about not only deep-seated and deep-rooted causes of violence, but also multi-sector, really powerful work that's happening in communities across our state to address it, to end it, to stop it before it ever happens. And finally, I have it here, pitching stories that broaden the conversation. I think that that's something that we've evoked throughout this conversation, one of the powerful things about creating relationships, one of the reasons that part of the work we're doing collectively is thinking about how to bridge bridge our roles and our relationships with journalists, is because when we know journalists, when we're part of their repertoire of people to go to, when we can be part of the story, that also creates a lot more opportunities for us to create our own news, to tell the stories that we know are happening, to tell the stories that we know need to be part of the discourse if it's ever to change, that we know are out there and are being too often ignored. And I've even seen some examples of those being told in the chat box over here to the right. So with that said, I'm going to turn it back over to Mago for a quick moment to reiterate how the chat box is going to work, how the question and answer is going to work. And I'm really, really excited to hear other people's thoughts and questions, arguments, any number of other things that are coming up for you as you're thinking about this work, things that have come up if you've had a chance to read the memo, questions you want answered, next steps you see taking shape, et cetera. So Mago, I'm going to hand it back to you.
Great, thank you, Pam. Okay, so as we move into the Q&A discussion section, we have about 10 minutes left, and I just want to let you know that we're going to give you two options for participating in the discussion, one through the chat box, which a number of people have already been doing, and then I'm going to ask Heather to give a quick overview of how to raise your hand in the system if you want to speak instead, if you'd rather participate orally. And then after, Heather, you give that brief overview, I think a lot of the content in the chat box can give us some fodder for kicking off the discussion. So I'll do a quick overview of that, Pam, if there's anything in there that you'd like to weigh in on. So Heather, could you give folks a bit of an overview for raising their hands and
Sure.
Yeah, thanks.
Sure, happy to. So as Mago just said, we have two options, the chat box, and then also for people who would prefer to ask their questions verbally, there is a little icon, and I apologize that I don't have an image of it. It appears in a different location depending on what type of computer you're using, but it just looks like an icon of a hand, and if you click on that once, it will virtually raise your hand, and then I will be able to unmute you so that you can ask your question. And then to unraise your hand, you just re-click the same icon again.
And Heather, where is it on the screen, like bottom left, bottom right, so people know?
So it depends on the computer that people are using, but for most, it will be within the participant column where you see your name appearing, so the lower left of the participant column, not the lower left of the entire screen.
Okay, great. Okay, so while people kind of gather their questions and input them, I'll do a bit of a summary of what's been going on in the chat box. But here are some of the questions that we'd be interested to get from you. Any input on what might have surprised you about the findings that Pam presented, any questions or clarifications, anything that you'd like to learn more about. What are the barriers that you're experiencing in your communities to changing the discourse? And on the flip side, what are the opportunities that you're seeing? And then we're really interested in knowing how our three organizations can further support community efforts to change the discourse. What's needed? What tools? What resources? How can we help? And as part of that, who else do you think needs to hear about this information, learn about this, and be a part of the discussion and the work? In the chat box, there's been some good conversation, a couple of people kind of validating our take on the current discourse as being very sensationalist and not addressing the root causes of violence. Stereotyping of the Latino community was mentioned, as well as victim blaming and a focus on individual behavior instead of environmental contributors. As part of the question of how do you define violence, there was some agreement in the chat box about the need to broaden this definition and emphasize the common risk and resilience factors that are there for among multiple forms of violence as a way to sort of draw community investments to make them more efficient and to encourage collaboration among sectors to address this problem. A couple people offered up some solutions that were pretty interesting, and Pam, maybe you have some a take on some of these. There was a research institute that said that they are looking to partner researchers with community groups in the Central Valley in California because largely the resources and funding go into criminal justice, so they're sort of exploring the connection of researchers to community groups as one of the solutions here. And then people mentioned a couple of barriers to this work. One person made a good point that in their community in, it looks like San Diego County, they've lost almost all of their community newspapers, and there's only one large paper left, but it's very conservative and not at all interested in changing its message. So how might we suggest approaching a problem like that with the changes in the media industry as a whole? And lastly, somebody brought up the fact that they have been organizing a youth leadership conference in LA, engaging young men and boys for a number of years, but unfortunately received no news coverage. So how do we really promote coverage of all the good work that's going on at the community level and kind of in that way shift the discourse from all the negative stuff to all of the positive change that's happening? So Pam, do you have any, with that kind of overview, want to weigh in on any of these points?
Well, there's a lot there. There's fantastic questions happening, I can tell. I want to do some more thinking. I think that the San Diego question is really a really valuable. Well, it just stood out to me because I know that that's an ongoing issue in a lot of communities. Is the consolidation of media. I know that when we've been talking about this work with some of the community leaders around Northern California, many of whom were thanked at the beginning of the memo. Several of them, who are many from the Central Valley, also spoke about that issue and talked about the value of identifying and elevating what's happening in smaller media sources and places which tend to, they need more stories, they have smaller staff, they may have smaller reach, but they represent an opportunity to start a conversation and create a space for it to be amplified. So unfortunately, I don't know enough about San Diego County at this point to speak about that, but that is one issue I'd raise. And I would certainly also encourage folks with specific questions, please do contact us at Berkeley Media Studies Group. I'll be providing my email address and other information at the end, because on a kind of a one-on-one basis, there may be some opportunities that we can think through together in a more kind of in-depth individual conversation. I think the memo is going to provide some more, in terms of thinking about how to elevate the conversation to go from a reactive conversation where we're being asked to feed into questions and frames that evoke victim blaming, that are sensational, and moving to a more proactive opportunities to pitch stories or shift frames when we're asked questions. I think there's some really good resources in the materials. I'd also really urge folks to check BMS, to do some scouting around at BMSG's website or connect with me individually for some resources on how to create news and shift frames. Again, the news is one piece of the larger discourse. We know it's not everything, but I think that we're uncovering and through this work and others really identifying some important ways to elevate the frames we want to see, to tap into values that are common to us all and that help us move beyond crime and punishment and into larger conversations about that emphasize more holistic and community-led and preventive efforts. So those are just a couple things that are coming up for me as I'm thinking through these questions. But I would also really urge folks to please connect with me individually so that I can either connect you with perhaps our technical assistance team here who might be able to provide some one-on-one conversations, or I just saw a comment that looked interesting in the comment box, but I'll try to stay focused. But also to please connect with me individually, because this is really one of the things that we at BMSG do and love to do is work with folks on the individual challenges that face communities in changing this narrative. We know it's hard work, we know it's real work, we know it's happening, and we want to, elevate it wherever we can, and again, support and do anything we can to keep the momentum that we're starting to see moving.
And I apologize, I also wanted to give Denise an opportunity to weigh in here with all the experience that you have in working with the media. Maybe you have some things to share or opinion about consolidation of the media and maybe the difficulty people have in highlighting good work of communities on the ground. Denise, are you there?
Hi. Can you hear me?
Yeah.
Okay, I apologize. So I think Pam covered it really well. It's just a matter of people that care about this issue, organizations that care about it, really need to work together to kind of create that movement. And as far as the media, I think it's just they're busy, they're short-staffed, and all of that. So we have to make it easier for them to tell the story from a different perspective. And I really don't have anything else to add.
Okay, well, are there any other questions from people, comments, clarifications? We have a couple more minutes, well, actually one more minute to squeeze in final thoughts. Okay, well, Pam, I think I'll hand it to you just to wrap up and finish off the presentation.
Absolutely. So first, I'm just putting in my chat box that's going to all attendees. I'm putting in my email address, which I just realized is not actually on the final slide. So please do, if you're interested in connecting with me individually or finding out more, please don't hesitate to reach out. As you can tell, I love talking about this stuff. I love this work, and I'm deeply, deeply honored to be even tangentially involved in this community of people doing such incredible, important, and powerful work for California and beyond. I want to direct folks to the memo that we've mentioned, the report that we've mentioned so many times throughout today. It's available at bmsg.org. It's highlighted on our main page. You can also go to resources/publications-main and download it there in PDF form. And it includes a lot more information as well as some additional places where we're doing thinking, and are, as always, so anxious to hear from folks and continue to connect and collaborate around this work and how we can elevate the work that's happening and change the landscape, change the narratives around our communities and how to build and strengthen them. And finally,
Pam, it looks like I'm not sure if we have time. It looks like we do actually have a question from someone.
Oh, let's see.
I'm
okay,
not sure all right, all right, Rocco, you are on the line if you have a question for us.
Oh, hello, can you hear me?
Yeah, I can.
Yes, we can hear you.
Okay, great. I did put in the chat box, and I got a link which I'm looking at right now, but I'm curious, as someone who works at a family violence agency with a robust program menu of school interventions around the prevention piece, one of our challenges in telling that story, both to the press and to other public forums, is how to prove or evidence, if we work with a group of middle schoolers today on teenaging violence or bullying or the traumatic effects of domestic violence in the home, how do we create a longitudinal arc with a particular middle schooler 10 years from now and say, well, because they worked with this preventative program, they were able to graduate college or get a better job or raise their own family in a peaceful and nonviolent way. How do we frame longitudinal and long-term impact prevention?
Sorry, can you just repeat that last part again? I'm sorry, you're just going in and out just a tad.
Okay. So I'm curious if you have ideas on how to frame long-term, longitudinal effects of prevention programs that we're doing today. What are the benefits that we can tell publicly?
I think I hear what you're saying. And Rocco, hi, by the way, we've worked together before on things, so always a pleasure to hear from you.
Okay.
Yes, hi. I don't know if anybody else, if Mago in particular, you have any thoughts from the work that Prevention Institute has done in partnership with community organizations about bringing kind of the long-term, as I'm understanding the question anyway, the long-term implications and impacts of your work to the fore. I can say a little bit, but Mago, you may have additional.
Yeah, I mean, it's a really good question. I think gets to the heart of the issue. I mean, one of the problems is that public health issues are very long-term, and the media is very focused on the short-term. So the question kind of raised two things for me. One was kind of the need to sort of maintain what I would call a drumbeat of media stories, so constantly continuing to foster the relationships with the media so that they're deep and accessible when you need them, and putting out sort of a constant stream of communications to sort of frame what you're saying, this longitudinal change. And the other thing that I was thinking about was the fact that the media is always asking us, at least in our work, for not just spokespeople, but examples on the ground and real people and real examples of solutions at work. So even if there are examples of individuals or, communities where these longitudinal effects are being seen, I think that would be great, I guess, fodder, for lack of a better word, for the media, for them to pick up on and develop stories from that. So I think those two things of maintaining this longitudinal media approach and providing examples, real-life examples and people will both help to kind of bridge that gap between the research and what the public is seeing through the media.
And as a follow-up, I guess the challenge is, how do you follow somebody over 5, 10, 25 years to say, yes, this prevention program really did make a difference in their lives, and then by association, their communities?
Yeah, and I think that's a challenge that researchers have as well, right? So the solution that somebody brought up, the Research Institute, that's kind of connecting researchers to prevention groups and community groups is a good one, so that there's more of a kind of a smooth line between the research and the practice and the media. Pam, I don't know if you have anything to add from more of a heavy media perspective.
I think you've done a great job. I mean, how to make prevention newsworthy is an ongoing challenge because prevention is often about the absence of something. And so I can definitely, Rocco, I can connect with you and with others if they're interested about some of the strategies that we've looked into about and we've really found to be effective around creating news around prevention programs and prevention outcomes that shifts the focus from the incident, from the bad thing that happened, to the broader picture of celebrating the work of those who make sure that those bad things don't happen. Because it really is, unfortunately, an issue of, or not unfortunately, but a lot of times it is an issue of creating news to help us get outside of the paradigm that the media is going to operate within.
And I think the thing that's kind of, undergirding all of this is the importance of partnerships and collaboration between multiple sectors and between people who are all working on violence prevention. And one final, I think we're over time already, but one final comment that came in through the chat box is somebody from the Urban Youth Trauma Center at University of Illinois, Chicago, and they are also looking for partners to collaborate with practitioners and advocates. And so hopefully we can, Pam, maybe after this we can send out information and help to facilitate some of those connections.
Fantastic. That sounds like a great idea. And Heather did mention she'll be sending out a recording of the webinar next week, I think, for reference, and I believe it'll be available on our website at bmsg.org as well.
And this is Denise. I just wanted to add one real quick thing about our work with grantees, the community organizations we work with is, I think, organizations learning how to tell their own story in a way that's compelling and kind of stepping out of public health speak or whatever legalese, professionalese, whatever kind of industry you're in, and really narrowing things down to the heart of the matter is a big thing. And we've been working with a lot of our community organizations on that. So I just wanted to put that out there.
Well, you can see that we are very passionate about this, I think collectively, both on the panel and in the audience. We're a little bit over time, in fact, but it's been such a pleasure and a privilege to be here talking with you all today and to be, continuing to share and collaborate and hopefully build power around this issue. I wanted to, again, draw your attention to ways to connect with us, and we're very, very anxious to continue this conversation and continue this work and continue building this together. And I finally just want to also say this is one of my favorite projects to work on, and in large part because of the people I get to work with on it. So thank you again for all that you do, and the work is hard, the work continues, and it's a privilege to be a part of it. Thank you so much.